Hi, everyone. I am Dr. Kat Karami, Medical Director of Allurant Medical. Today, I want to talk about a very simple, what seems to be easy topic, neurotoxins. Botox is sort of the Kleenex of neurotoxins because it's been around the longest and it's the best known. It comes under different names. Dysport, we have Xeomin, there's also on the market Juvo, and they're all botulinum toxin A. There's other kinds of botulinum toxins that are injected, but for aesthetic reasons, botulinum toxin A is what is injected. This botulinum toxin is very locally injected into certain areas where we want the muscle movement to stop temporarily. And it works by going and acting at the junction of the nerve and the muscle, so putting the muscle to sleep temporarily. So actively, you cannot contract the muscle. And what happens then the body metabolizes it and gradually the movement comes back. On average, it lasts somewhere between 3 and 4 months after the injections. The more the number of units, which means the more the amount of botulinum toxin A delivered to that specific area, the longer the effect is going to last. And if you want what is called baby Botox, just a little bit of a Botox just to allow some movement, it does allow for movement to come back sooner. It creates a more natural result if done well with the balance of all the other muscles kept in mind, but it does wear off faster. The other thing that can also happen is that our bodies recognize the botulinum toxin A as foreign to our body, and they produce an antibody. Every time you have something in your body, your immune system goes into gear and reacts to it. This reactivity to Botox can potentially cause a resistance that develops over time, a tolerance. So, to minimize the possibility of tolerance to Botox, get what you need and then don't get it again for at least 3 months. The best strategy is to get all of exposure to Botox in one session and then take a break for at least 3 months and then repeat. Sometimes 4 months. Some people are comfortable with 6 months. Everyone's metabolism of this drug is different. One thing I want to say before parting is that think of Botox as a management of expression. I don't like chasing lines with Botox because I think it is not the right way of addressing wrinkles per se. Expression management is a good way to use Botox, keeping in mind the opposing muscles that lift the eyebrows or make the expression of the mouth upright. But if you're chasing lines, then you can make the person inanimate with little movement and maybe looking good in a picture, but not necessarily in real life when they're animating and talking with friends. You want that balance of a good feeling to the face as a result of the management of the expression balance. That's right now what I'm going to say about neurotoxins in this particular video. There is more information on specific use of neurotoxins on a different video, but make sure that you have a good discussion of what your goals are and that your injector is knowledgeable about the anatomy and the judicious use of neurotoxins in your face.